what is Adult Day? So years ago, we switched over from calling ourselves Adult Day to Life Enrichment. We are still licensed adult days through the state of Arizona, and we have an accreditation as well that I'll talk about. But we really wanted people to know that our programs are life enriching, and we want them, they're adult-like, there's not children's stuff going on. So years ago, we kind of had a take-back day in our day programs, and anything that was childlike, we have a child care as well. So we gave that over to the child care, and we switched it up. So now we do creative arts, and you'll see it throughout here. We do canvases and watercolors, and we have Zumba instructors that come in, and we really try to make it to what is going to fit everybody in the room's need, and stuff that we would want to do if we needed to go there. So it is, like I said, a licensed adult day program. It's a group setting and it's supervised. So we have set ratios. So the state ratio is a 1-to-6 ratio. In our programs, we do a better ratio than that. So at Mary's Place, we do a 1-to-4. Lucy Ann's, we do a 1-to-5. And at West Valley, we do a 1-to-5, 4.5, 5, because we want that quality of care. So what is going to help the individual who's attending the adult day? And I'll get to it at the end, but we do free trial week, so that may be something good you might want to try out, because if it's for you, it's for you. If it's not, it's not. But it's really going to improve that quality of life for your loved ones. So we hear a lot of people say, well, I can have home care that comes in, but there's not going to be the socialization, the interaction, the friendships that are made. So it's overall quality of life. And that isolation and loneliness, we hear about that all the time. A lot of our seniors are socially isolated. They're stuck in their homes. They don't want to get out. Plus, we live in Arizona, so when in the summer, we don't want to get out anyway. This gives that specialized care, and our staff are amazing. They get to know each of the members and get to know what they like, what they dislike, and they become family. It's really hard on our staff when the members have to discharge or not come to the program anymore. And it gives your loved one that socialized setting with a larger group. So a lot of our members come on the same day every week because they make those friendships and they get used to that routine, and they have set things that they're looking forward to do. And then of course it allows us all to age in place. There's a ton of overall health benefits. We have a registered nurse on site at all 3 programs. So if there's medications that are needing to happen, we can provide those. And then also, if we're starting to see something unique, we're going to call that individual's doctor and have that connection with them. So we're looking at that overall health, as well as there's a full hot meal every day for lunch. And so some individuals, that's their big only hot meal of the day. So we either have a super salad, a whole meal, and then a dessert. And then we have a morning snack and an afternoon snack. And like I said, making new friends and building relationships and giving us purpose and meaning. When you get retired, I hear you want to have purpose and meaning, that you want to have a place to go or go volunteer, and this allows for that. So in our day programs, we focus on the 7 dimensions of wellness, which are through the International Council on Active Aging. Every activity and everything that we do in our programs needs to revert back to one of these 7 dimensions of wellness. It's very, very important to us because we don't want to be doing something just to pass time. I'm going to give you a really good example. We've always done bingo. And when we switched over from adult day to life enrichment, I was like, guys, maybe we don't do bingo anymore because, bingo. We tried, and the members loved bingo. Greg, do you love bingo?
Yes, I do. I won yesterday, too.
Yes, so you know what? That gives them meaning and purpose, and that goes back to one of our 7 dimensions of wellness. So if that's going to do that person-centered care, we're going to still do it. So it's emotional, intellectual and cognitive, physical, that professional and vocational, social, spiritual, and environmental. I had mentioned person-centered care, so we're all about person-centered care. It's about the member when they're there. I always tell families the only rule is they cannot leave the program without a staff member or their caregiver or their family member. But that program's there for them. Some of them are there 5 days a week, 9 hours a day. Which means we're not going to make them do anything, but we're going to help support them in anything they want to do. So I may be like, Greg, do you want to come and do the exercise class today? And he's like, you know what, I didn't sleep good last night. We'll kind of let him relax, but we may walk back by Greg and say, Greg, I really need somebody to help us lead this group, and you do really good with the upper movements. Can you come help us? So we can be very creative in how we try to engage all of our members. And we really honor that choice as well. So we even have families that come in and say, my mom needs to go to the bathroom every 2 hours. We're not going to make their mom go to the bathroom every 2 hours, but we might have the mom walk with us on a little walk and happen to walk by the restroom and say, oh, we're here, do you want to stop in? So we really try to be creative in how we do that. So this is in our welcome packet, and I'm not going to go over everything, but this is kind of the basic criteria to attend one of our programs. So you have to be 18 and older. That's one of the biggest things. The other thing is we have to have a doctor's form filled out, which is called the medical provider assessment, and a current TB test. That's even if you do the free trial week. And we will help connect with your doctor to get those done, and then we get those updated every year, so we kind of know what's going on with your health status. And then the other big thing is it's a one-person transfer. So if that individual needs more than one person to help assist them from a wheelchair to a chair, then they're not appropriate. But we can connect them with other programs that can help them. CARF accredited. So this is one of my favorite things. We are the Commission on Accreditation of Rehabilitation Facilities. This is an international accreditation. The adult days in the state of Arizona are not required to have any accreditation. They just need to be licensed by the state. For 21 years now, we have been accredited. We are dementia specific accredited as well, so that puts that extra piece on it. It's about 1,800 standards that we meet that goes way above and beyond the state standards, and we're very proud of it. And so they just came like less than a month ago, and Pam and Greg talked to our surveyors who came out. So they come out every 3 years for 3 days and look at everything. They talk to our caregivers, our staff, everything, and see what we're doing. This really just shows our quality of care, that we don't just stick with the state level, that we go way above and beyond. And then I'm also a CARF surveyor, so I go out to other places. I'm going to Canada next week to survey their sites and see best practices that I can bring back for us as well. So these are our 3 programs. Lucy Ann's Place is over in Surprise, that's our main campus. Mary's Place is here, and then West Valley is over on 81st Avenue in Cactus. So Lucy Ann's, that's really for individuals with beginning to moderate stages of dementia, Alzheimer's, stroke survivors, and Parkinson's. So you don't have to have a certain diagnosis to attend there, but it's a variety of individuals who go there. We accept the VA contract, Altex, Area Agency on Aging, Sale and Family Care, and private pay. And I'll talk a little bit more about that because some long-term care insurances are willing to pay for adult day services so that it helps save that insurance company money if you get placed later down the road. So there's some different options. One great thing, if you haven't been to our main campus, is we have a child care. We have an accredited child care on campus. It's just for anybody in the community, but we serve 6 weeks to 5-year-olds. And every day they do intergenerational. So every day the grandmas and grandpas and the kiddos get together for at least an hour. They have a whole intergenerational garden. They do baking, cooking, creative arts, music, all kinds of fun stuff. So it's a very big uniqueness. And when we built that campus, we solely built the childcare so we could have that intergenerational. And it's a really cool concept. And we're working on getting intergenerational in the other programs. Right now at West Valley, we have the Boys Girl Scout that come in, I believe once a week.
Wednesdays, yeah.
Yep, on Wednesdays once a week that come in and do activities with the members. And then we also have Midwestern University, and they come in and do OMA, which is Opening Minds Through Art. It's an art program that we have college students who come in and do that. Here at Mary's Place, it's for the moderate to later stages of dementia. So if we have an individual who starts at West Valley or starts at Lucy Ann's and they progress in their journey with dementia, we don't have to be like, we can't serve you anymore. We have that continuum of care, so we're able to have them come over here to Mary's Place. Like I said, this is moderate to later stages, so this is a secured facility. Now, if you push on the door for 10 seconds, it will open, but otherwise you have to have a code to get out. We are the only dementia-specific secured facility in the state of Arizona, and this program also is dementia-specific CARF accredited. So we're very proud of what that program is doing over there. And a lot of times the members stay there until either they pass or they have to get placed because the caregiver can't do it anymore. They accept all the same contracts as well and private pay. And then West Valley, that is for, it's a mixed population over there, and it's beautifully mixed. We have beginning to moderate stages of dementia and Alzheimer's, stroke survivors, Parkinson's, and then we have the adults who are aging in place that have a developmental or cognitive disability. It's a beautiful thing to walk into that program and see how well they all connect and how great the populations mix. And we rent a space out of the church at Cactus over there. caregiver stress and burnout. This is the stuff that caregivers don't think about, and it's hard to think about, but we also want to put it in front of everybody to make sure we understand what you guys as caregivers need to do for yourself as well. So caregivers spend on average about 24 hours a week providing care for their loved ones. 1 in 3 caregivers have no help at all, which is why we have our services here and what we're doing. Nearly half of all caregivers over the age of 50, and most are women. 63% higher mortality rate for caregivers than non-caregivers, and we just said that here at the beginning. So that's a big number. That's a very big number. The same study reported that 40% of Alzheimer's caregivers die before the patient, not from the disease or accident, but from the sheer physical, spiritual, and emotional toll on caring for somebody that you guys do love and care for. So how would this program, if your loved one was going to go to it, how's it going to help you as a caregiver? It's going to improve that quality of life for you. You can go out and do stuff with your friends. You can take a nap if you want. You can plan things where you are taking care of you. You can go to your doctor's appointments, those types of things. It's going to give you that much needed break. We all need breaks, whether we're a caregiver or not. The caregivers more than those who aren't. This is also going to allow you to know that you have quality and expert staff who are supervising your loved one to make sure that they have all their needs met and are there to actually love and care for them. And like I said, allow you to take care of you, your mental health, and your well-being. So last year, 268 individuals used our day program services. It's a lot of individuals that we touched, and it gave over 122,000 hours of respite. It's a lot of respite for caregivers that we were able to do. So what's our expanded goals of coming to our day programs, and what are we ultimately trying to do? We are really going to do that combination of the 7 dimensions of wellness for the International Council on Active Aging. We're going to do that physical, mental, social, all of that, structured and unstructured opportunities for the individual coming in as well as their caregiver. We have that medical piece. So we're not a medical model. Our nurses do not wear scrubs. We do not want them to wear scrubs. But we can provide the medication, the extra oversight, and our nurses are amazing. They love our members. They are definitely there for our members. This helps to keep those activities of daily living going. One of our big things in our programs is really making sure we're always doing exercise, we're always doing movement, because if we can continue to do that, as the individuals in our programs age, we can help them strengthen so they don't have falls, because a fall could lead to way more than just a fall. This allows the improved health for the caregiver and the member, and also that care and counseling. So here at Benevilla, we have a CARES department, which is our Community Assistance, Resource, Education, and Support department. If anybody in the community needs anything, even if it's a food box and we don't provide that, they can call us and we're going to connect them with the right service. We have our support groups, our educational events. So we're not only looking at the individual who's attending the day program, we're hoping each of those families are using a variety of our services. We want individuals who come into the day programs, we want them to stay in their home as long as possible. We don't want them to have to go get placement. So if we can do that by having them come to our day programs, that keeps them in our community. Giving that respite, reducing that isolation, and improving that nutritional status. So here is some ways that adult day can be paid for, because we hear about often, I can't afford it. If you're a veteran, then the VA will, more than likely through your case manager, you can get the services covered. We also have Altex, which is Arizona long-term care system. So if a family has those benefits, they will cover the programs as well. We contract with area agency, and they usually have a sale and family care program that's based not on finances, it's based on need. Right now, I think there's a wait list with all of the political changes that have happened, but you can still call and get onto that. A lot of long-term care insurances, like I mentioned, cover it now. The Alzheimer's Association and Caregiver Coalition also have different grants that can help get started. And then Benevilla really was great last year to think big picture. And so we were able to pull from some of our operating funds for all of our day programs, our childcare, and our adaptive gym, and start a $10,000 fund for scholarships. And every bequest that we get in, 5% goes into that. So there's qualifications to get on the scholarship, and it is a cost share. But if a family is eligible for it, they would pay a portion, and Benevilla would cover a portion for the need so that they can use our services. So we do have that as an option. And then our free trial week. So you can come into one of our day programs with your doctor's form filled out, your medical provider assessment, and your TB test done, and do up to 5 days in 1 week for 4 hours at a time. We cannot pass medications during that time, but you can really come see what it's like. If you're not interested in that, you could come join us for lunch one day. We can order a lunch and have you join us then. If you just want your loved one to hang out and kind of do a feel for it, you can hang out in one of the offices. We have a lot of creative ways. We've even had caregivers that are like, my husband is not going to go to that place. So we've been creative, and they've come in as a volunteer. We've given them a volunteer badge. The staff know they're a member, but we have them help us with stuff, and they really feel that empowered and have that purpose.
Quick question about that.
Yes.
With those opportunities during that trial week, that would be me and my mom attending.
The trial
this.
week, as long as we have a negative TB test and the doctor's form,
Okay.
you can drop her off for up to 5 days a week, 4 hours at a time, if there's room those days.
Okay.
But you can, if you want to kind of get a feel and see, like, we want you guys to be comfortable. So we always tell our caregivers, you can come in at any time. Like, we're not putting on a show at any time. And
Yeah.
so you guys can stop in at any time. So you can do it either way.
Okay.
Most of the time, the families drop their loved one off, leave, and then come back and talk to the staff when they get back and see how their day went.
Okay.
But there's both options.
Okay. Or even if we were just to have a meal, the two of us, assuming she has the TB test and all that.
If you just came to have a meal, you wouldn't have to have the doctor, because you would stay with her.
Okay.
You wouldn't have to have the TB test or the doctor's form.
Okay.
So we have a lot of different creative ways we can do things.
Okay. Great.
So that's all I have. I would love to open it up to Greg and Pam, if you guys don't mind. I asked them to join us. Just to kind of talk about their experience and being enrolled over the program and how it's helped Greg as being a member there, and then how it's helped Pam as a caregiver.
You want us to just kind of talk, or do you have questions? How do you
Well,
want? How do you
Ben,
want?
do you want them to like introduce who they are? Because I think
Please.
they might do clips too.
Gotcha.
So maybe
Okay.
introduce who you are and how you are associated with Benevilla.
Okay.
I'm gonna brush my hair if I know.
Here,
It'll be all right.
you know, like the mom.
Right.
Yes.
So I'm Pam Zucala, and I am Greg's wife and caregiver. And we've been with Benevilla about, I think we were trying to figure it out, maybe since October of 2024. And it has been a lifesaver for me.
Yeah.
Because I am his only person. I'm not going to get into the specifics, but Greg was diagnosed with Alzheimer's about August of September of last year. He's had cognitive issues for the past 10 years. He's been retired for the past 7 years and pretty much a couch potato those whole 7 years. Since he's been attending, he started out 3 days a week, because through the VA you have to commit to 3 days a week at the beginning. And his second week there, he asked me when he could start going 5 days a week, and I was like, I was kind of shocked, because it was hard for me to, it's like dropping off your kid, and I was like, whenever you want, because we had applied for 5 days a week, because that was what was suggested, to ask for 5 days a week, because the VA has been very gracious in paying for him to go there. We also live right across the street from the West Valley campus, so I walk him there unless it's raining, and then we drive. But it has been a lifesaver for me, it really has. It was difficult at first, very difficult to be at home and be like, okay, what do I do with myself? You know, I don't have this person sitting in my house, you know, with the TV on or the music playing, you know, helping with some things around the house. And it's still to this day is his, you know, learning curve for me. But when I go over there for events and I see what goes on in there, or if I come to pick him up, and sometimes, see, like today I picked him up a little early, and just, you explained it perfectly. It is like family. Most of the time when we walk in the door, Lindsay, the director, or Shauna,
Any of them.
one of the people that work there,
Yeah.
one of the aides, they already have his day planned for them.
Which is,
He's like their little helper.
oh, yes, I am. I was,
Yeah.
sort of got into that.
Yeah, he helps care for the garden,
Yes.
he's the DJ. I don't know what Lindsay had planned for you yesterday, but we didn't even get a chance to say goodbye, and she had him already off and doing whatever. But I really think it's improved his quality of life.
Yes.
I mean, I could go on about, you know, they, at the West Valley at least, just recently for St. Patrick's Day, they had a gentleman come in and sing and play music, and they had a dance, and everybody, wheelchairs, people
Yep,
that,
walkers,
you know,
yeah.
are on their walkers, whatever, they're up, they get them up and they're dancing.
Even me,
You know.
and I don't.
Wonderful.
You know, and they have the people that work there get up and get people up and
Yep.
moving. I have to find wall space for his artwork.
Yes.
Yeah, and he has friends there.
Mhm.
That's the best part. He has friends. He'll tell you in a heartbeat that he doesn't like people, but he really does. He is very good with people. He's worked his last 5 years of work. He worked in the medical facility, in a medical facility, and to this day, if he were to walk into that facility, they would tell him patients still ask about him.
Yes.
Because he
Yeah.
was, and that's how he is. And I know when he goes over, he wants to be helper. He wants to help because that's the way he is. And he fits in with everybody. From what I'm told, he sits with anybody and everybody at the program. He has his buddy. We call them the troublemakers. Him and Dennis the Menace. But Greg will sit with everybody, and he gets along with everybody at the facility, and it's kind of fun when I go to pick them up. You know, they're always waving to me, hi, I know you, you know, and some of them have, you know, some different disabilities, and I don't know if they really know me, but it doesn't matter.
Sure.
You know, they're very social. So the caregiver burnout that you talked about, it's real.
It's there.
It's real. I have my own health issues. August of last year, I had to have a pacemaker. So I have to be really careful with, you know, with taking good care of myself. And now that he is over there, I can do that. I got very involved with support groups, with him being with the VA. I have a one-on-one, today was my last day with her by choice because I have other things that I'm doing. One-on-one counseling. And then I attend a support group the first and the third Thursday through the VA, which is at the West Valley campus, which apparently they're not communicating, but that's okay. And then there's also caregiver support here, which I have not attended yet, but it's something I'm going to start looking into. But I had no idea the support that was there for both of us. You know, I thought I was going to have to do this all by myself when we got the diagnosis, and I'm so grateful that we don't. You know, there's, like yesterday, I had nothing to do. I had a whole day with nothing. And that's very unusual to have happen. Last week at one of our support groups, they told us our calendar is our calendar and we can control it. And when I went home after that group, I went and I changed a lot of my appointments so I could have days off to take care of me, because it's important. You know, when we get on an airplane, they talk about we have to put our oxygen mask on first so we can help other people. And that's what we have to do as a caregiver. We have to take care of ourselves so we can be for them, and we can outlive them. That really choked me up when you talked about that 63%. Yeah, and that's one thing he's very concerned about, is me going before him. At least I know that he has somewhere to go during the day, you know, God forbid if that happened, but do you have anything to add?
I think you've done quite well, but
We'll
you know,
talk about, you can
add-
talk about
yes, I
what
can
you
talk
do.
about what we do.
Yeah,
I like it. I didn't think I would, because I don't like people. But that's, you know, that's just me. From the time we went in for our interview and got to go inside and meet the clients and the aides and all that is just, they're just friendly. I mean, and they're not pretending. They actually do care
Yeah.
about us.
they know my name.
And
When we walk
that's-
in the door, especially there's one, she'll yell from the kitchen, which is, Paulette, which is probably 2 rooms away.
Yeah.
And I hear her, "Hi, good morning, Pam." And where else do you get that, you know?
And they'll stay late, they'll come in early if they have to. It's just, the staff cares, which is, you don't see that in a lot of places. And I worked in medical field for a lot of years, and I miss it. So I know, because I was one of those people. And if I would have known that they were there for the last 15, 20 years, I'd have been working there. I already know, whatever job I was working, I would have quit that and went, because that's what I did.
Yeah.
And it was, I miss it a lot. But the staff, Lindsay and all the aides, they give me that opportunity, and I think they do it because they know that I can do it and I want to do it and I like doing it. And that's one of the things there that it's, and I'm sure they're all like this, which is, wow. One thing maybe, interact the different areas, people, you know,
Yeah,
like
so-
the bus or something.
Yeah, so we've talked about that, we have to have enough space to do it at each site, but I know we've been talking about taking some outings from West Valley over to Lucian so that you guys can do stuff with the littler kids.
Okay,
And so we used to have a program at the St. Clements of Rome right here down the street. And when COVID happened, we closed our programs for about 6 months, but they needed that space back. So we ended up closing that one, but they had a huge bingo hall. And so we used to get the programs together all the time there, but we had to make sure we're in a licensed facility, there's enough space. So we're working on some of those ideas though.
yeah, and you always are.
And
You
they
know.
go on field trips.
Yep, oh my gosh, yeah, I mean, it's,
And it's interactive. They ask the clients, is there anywhere that, and he wanted to go to the music museum, so that was one of the places that
oh
he
my
went to.
gosh, if you've
they
never
went
been
to.
and you like music,
It is.
go. Because you could spend 6-8 hours there and want to go back before you
So the
get in car.
outings are, just so you know, we try to do a couple a month if we're able to. We have a bus driver and we have our own Benevilla buses, and it's usually like 8 to 12 members at the most, so it's not the whole program, so people can pick and choose. Sometimes they just go out to lunch, or
Yes,
when
yep.
it's nice out, they might go to the park and have a picnic.
Casino,
The casino,
Casino.
yep. I know you guys have been talking about the casino.
not me, I don't, but
Okay,
I'm
I know they
not a
have it.
gambler because I am not good at it, so I know better.
But like she said, it's up to the members of where they
Yeah.
go. We don't pick that, it's
Uh-huh.
what they want to do, so.
Yeah.
And we celebrate, you know, birthdays and all special events and all the holidays, and we do enough crafts for all of that.
They
and-
also do concerts,
And, oh, yes.
They
we
have
do
their
have-
own choir over there.
Yes.
Yeah, so we are,
and they're very good.
we're practicing again
Yeah.
for one, I think
There's
we're moving
probably a
into July
video
now.
on the Facebook page.
There probably is.
Yes, and it's
Christmas.
Crescendos.
It's
Yeah.
amazing. It's amazing to watch, like you said, because of the diversity of the clients that are there. And even, you know, when I'm picturing, I don't remember his name, but when he gets up to dance and they get him to do this little shimmy, and it's just so much fun to sit back and watch. And, you know, I always make sure I check the calendar so I can go to those events. And, yeah, I don't